This is Dr. Dave Nelson, and we have Dr. Ahrens and Dr. Gluckman on.
So this is John Gluckman up in Vancouver. I'm a retired doctor of chiropractic, and I've communicated with Dr. Ahrens several times about his product, and tonight I just want to introduce him to all of you on the phone. He is very soft-spoken. He's very kind with his time. He'll spend as much time as we want in terms of answering some questions.
I have two questions. People have called in or text me. So, Dr. Ahrens, type 1 diabetes, and how does this affect weight loss? Two different topics, but type 1, is it effective and supportive, and also in the area of weight loss?
Well, we couldn't undertake every single study that we wanted to undertake initially, but our first animal study with type 1 rats, these were rats that had no functioning pancreas. They were type 1s. That was our first study, and we not only kept those rats alive without a functioning pancreas, but it reversed the type 1 diabetes. And it was, I was discussing that with a head of research at a major pharmaceutical company, and there's just hardly no way around it. We appear to be rejuvenating beta cells. That means that there's endogenous production of insulin after taking products such as inulin. Now, we were thinking, okay, what are we going to do? We can go down the type 1 route. We were going to do the pharmaceutical route, and we decided that we were going to keep it a food supplement because really that's the issue. We don't need another drug. What we need is just people to get this stuff into their diets. And we were going to focus on type 2 diabetes at the time because my partner's mother had type 2 diabetes. That's really what pushed us in that direction. So then when we did our human clinical, it was a small one, but we reversed type 2 diabetes. So I can say, yes, I'm certain it helps type 1 diabetics, and I have given it to my own relatives that have type 1, but I do not have the clinical study to back that up. There are plenty of papers, though, you could just find on PubMed about endogenous insulin production and polyphenolics. So yes, for type 1, you've got nothing to lose. It's not going to hurt you. It's not going to interfere with anything. It's just that as you get better, you need to watch your intake of your medications because you become healthy, you won't need them, and you could go low blood sugar. You know, you have to monitor your blood, and if you're type 1, you're certainly monitoring your blood. I had a story of telling this one lady who was on an insulin pump, and I said, look, I am not your doctor, and any one of people listening, I'm not your medical doctor, I'm not a physician, I'm a researcher. So that's take care of that legal statement there. So tell everyone, if you're in that situation, you need to consult with your doctor, you need to get with them, but it absolutely works. Worked in those rats fine. As far as weight loss goes, the weight loss, the way we've approached this is weight loss is kind of a side benefit because there is a direct correlation, as most people know, certainly the doctors here, a direct correlation between blood sugar levels and weight, excess weight. So you may not be pre-diabetic and you may not be diabetic, but you might have a little too much sugar in your blood, and insulin is going to look to put that into fat tissue. So we inhibit that action. We do not shut it down entirely. We think the body knows what it's doing. We just inhibit it a little bit. We get the sugar to be burnt up in muscle tissue and also into your brain. The brain only lives on glucose in most normal situations. It just thrives on glucose. So the result is you feel energized, you feel bright, and you'll start losing some pounds. Now, there are two amylins out there on the market right now that you have, M and C. And the M is for people who have no concern over blood sugar levels. They're not pre-diabetic, they're not diabetic. They should take the M because that M contains more quercetin, which is very conducive for glucose to leak out of fat tissue. Quercetin causes glucose and triglycerides to leak out the process of lipolysis back into the bloodstream, and then it can be burned up in the muscles. So that's great for weight loss, but it's not too good for diabetics. So we have the C, which has less quercetin, only a trace amount, so that we won't have to contend with any elevated blood sugar levels.
Understood. Okay, and so I'll go back to a couple more questions before we open up to the rest of the people on the line. There's a question here about, can you ask, okay, so what are the benefits of taking both M and C together? Why would someone take both, and how many?
There's not any reason at all to take them together. They do not have separate effects. They are the same compounds. The M has more quercetin in it. The C has less quercetin. So there's no benefit whatsoever. You're getting enough with the C.
We're good.
Okay, that's a good one. Now, on the iGalens website, it says pregnant women and breastfeeding women can take Emulin. On the Canadian labels, however, there's the warning that this is not for, breastfeeding or pregnant women. Usually that's a Canada Health warning that they put on almost all products. Would you know of any other reason why that warning would be in place, and are you comfortable with just saying that it's safe for any pregnant woman or lactating woman?
Yes, so if people that follow my discourse here, I think this should be in everyone's diet. I don't care who you are. If you're a fetus inside the womb, or you are a breastfeeding baby, or you are an adolescent, or you are middle-aged, or you are aging, everyone needs to take this product. It's just like a vitamin. So, yes, there is no problem. I cannot imagine a problem that could occur. In fact, it is a theory that we are close to finishing on some publication that type 1 diabetes happens because the fetus is flooded with refined sugar without any inulin-type compounds. So if you are predisposed genetically to getting diabetes and you get flooded with refined carbohydrates in the womb, you're going to get type 1 diabetes. If it happens when you're an adolescent or a young early adult, you're going to get type 2. And eventually, if you keep it up your whole life, you're going to get diabetes type 3, which is, you'll Google that, you'll find out that's Alzheimer's. That's been called type 3 diabetes since around 2007. And it was very interesting because an article, a publication came out last week on a direct link between refined sugar and Alzheimer's. And it's something that we actually discovered independently in 2007. So there is no problem, and you're right, you have to put that on the label because we have not done a study nursing mothers. If we did, then we didn't have to put it there. But as I said earlier, we just can't do every test imaginable.
Sure. Okay, covered very well. Thank you for that one. Dr. Nelson had asked about the sports performance. Is there any enhancement by taking Emulin, and what kind of dosage would, let's say, cyclists or long-distance runners or people doing heavy lifting or body work, would they get a benefit in their performance statistics?
Well, Emulin causes efficient carbohydrate management. So without Emulin in your bloodstream, you are at a great disadvantage. You just don't know it. And you take carbs, you load up on carbs, especially people such as distance runners and sports like European soccer, what they call football. They can't take a break. You're not allowed to change people in and out. And usually the team that wins is the one that had the most energy throughout the game.
Right.
So this causes to be less of a peak. There's still a peak when you load up with carbs. You get a peak, and then you get an overcure, a swing, overcompensation, and then you get that lull, that crash.
Right.
Inulin, one of its main functions is to smooth that curve out and make it longer lasting and lower. So you feed your body with that carb at a nice even rate. We have in our company, ATM Metabolics, is partly owned by one of the owners of the Boston Red Sox. Cool. And there's plenty of players that are on that product, and that's what they report. I can just go longer on the same amount of carbs. I used to be able to run so much, and I can go further, or it allows them to use less carbs, depending on what they're trying to do, and have the same performance.
And isn't it true that the Williams girl that just won the tennis tournament has been on this product for a while?
Yes, Serena Williams. Yes,
Serena.
Her trainer. Her trainer used to own several GNCs years ago, back when we were trying to sell this product to GNC. And that's how he came across it. And he just, every product that came in his store, he or one of his staff tried it, and he got phenomenal results. He asked Serena to take it, and she's on it. And she says she just doesn't get as tired as she used to.
Fantastic. Good to hear that.